Last week, Dawn and I talked about 26 years of marriage. And to let all listeners know, we're still married. We made it an actual 26 years and a week so far, right?
Yes,
right?
Correct.
She's like, yeah, a little bit of a pause there, Dawn. we dove into life, leadership, and legacy. And this week, we want to dive a little deeper into the number 26. But we're looking at it through a very different lens, aren't we, Dawn?
Yes, we are.
We talked about last week about 26 years of being together. And this week, we want to talk about 26 years of how the compliance landscape has changed literally underneath all of us. The technology has changed, the threats have changed, the rule book's changed. But one thing hasn't changed is proof and evidence still beats a binder and your little trust center, doesn't it?
Correct. Every time.
Welcome to the Van Ryn Compliance Podcast with Rob and Dawn. We help growing teams reduce risks, build trust, and stay audit ready without the overwhelm.
I'm Rob.
And I'm Dawn.
And if you're new here, we're a husband and wife team, business partners and founders of Van Ryn Compliance. And today we're going to walk you through the actual changes in compliance, what really hasn't, what has and has not changed, and what leaders should be doing right now.
Correct.
So welcome, Dawn.
Yes.
How's the
Welcome,
first 26 years been?
Wonderful. It's just like yesterday.
There it is.
Yeah, just like yesterday. Yep.
Still going.
Exactly.
Oh, well, why don't we talk about the landscape, right? So what's really changed, not about a headline, not about the stuff that does or doesn't matter, but let's kind of start at the floor. Let's go way back to the HIPAA, as I like to call it, because it's the only law.
Mm-hmm.
The only law. Nothing else is a law.
It is.
But it's the only law, and the HIPAA security rule was published in 2003. It's getting aged.
It's getting aged. Yep.
And for the first time, healthcare had a real federal security baseline for electronic protected health information.
Correct. And this included what you guys already probably know, administrative safeguards, physical safeguards, and technical safeguards.
Yep. Those are the three key pieces.
Mm-hmm.
Think about your risk, know where your information is, and protect it. And of course, you've got to document everything and where it goes. But from 2003 to 2005, a lot of covered entities were required to actually be operating under that rule. And then there's something that dramatically changed in 2013.
Mm-hmm.
Yep.
Yes.
Walk us through the omnibus rule, Dawn?
Yeah. So the current rule, still the rule until we hear otherwise. There is a meeting with the HHS. There is a conference in a few weeks. So we will hear if there's more to come. But in 2013, we got the omnibus rule. Mm-hmm. And that's when, ding, 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 the big relationship between covered entities and business associates really changed. Yep. So business associates couldn't just stand next to HIPAA anymore. They were actually also had requirements.
And they had to adhere to the security rule, administrative, technical, and physical, just like a covered entity.
Right. Now, should we explain, if people still don't know, what a covered entity versus a business associate is?
Which one do you want?
Possibly.
Which one do you want to explain first?
I'll do covered entity. You business associate.
Right.
Covered entity, that is basically doctor, covered entity. They are the medical facility that has the medical record. They are, the covered entity. There's more to it than just a doctor or a dentist or a chiropractor, but that's just kind of all in a nutshell, or a hospital, clinic, that type of thing.
They're the ones that create the medical record.
Yes, they create it.
And the business associate is the company that supports the medical practice or hospital or clearinghouse. So yes, it could be an IT provider. It could be an MSP. It could be your IT provider. It can be a SaaS company. It could be the clouds, the Amazon, the Google, the Azure, personal cloud, data cloud, any cloud. It could be your AI bots. It could be a courier service, an answering service. It could be a shipping service. Anybody or any entity that comes in contact with the health information, even incidental, is considered a business associate. Therefore, you have to have a business associate agreement with every contract before you actually see or support any health information.
And what is a BAA, you may ask?
Exactly.
A BAA is about a 12 to 15 page agreement between yourself and the covered entity and each of your responsibilities in regards to handling EPHI, disclosing EPHI, and if there was a breach that occurred, notification of that. So it tells what each responsibility is. And there's also, you go take it a step further, you
Mhm.
could be a business associate working directly with a business associate, which means now you've got a business associate and then you've got a subcontractor business associate versus just a business associate and covered entity. So there's lots of iterations, but more importantly, this was very important that this was now a rule that came to play. Very important in HIPAA.
Yeah, in business associate agreements, BAAs should only have what's needed for the healthcare law. It's not a place to put the requirements for your cyber, for your MFA, for your penetration testing, for other requirements. You need to certainly strip it down to just what's needed for the BAA. Everything else goes like your service agreement or other contract. Keep it all separate. I'm starting to see a lot of it blend, and you don't want to blend it in there. You want it separate different things. But it's a whole economy, and this is where in that mid 2010s, 2020s, I know going to the Wayback Machine, that's where platforms and cloud and everything started exploding, and healthcare was a major target and opportunity, just kind of like financials for cloud computing, and that's where a lot of the reasons for business associate agreements came out, is because we've got to protect protect the data in the cloud, all the whole data. Yeah, because from that, what came.
Mm-hmm.
The claims, the pharmacies, the
Yeah, the
providers,
the patients. Yep.
Yep, it
Yep.
keeps going.
The cash flow, the care delivery, the operations, all that. Yes.
Yeah, that's kind of the conversion between the old cybersecurity and what we have today. And it not just can someone see the record, but can they download, access the record,
or incidental access.
Incidental. Yeah,
which could be they never access, but incidentally, if they do,
Mhm.
you have to have a BA.
Yep. Incidental would be
Yeah.
like a courier service, which we have clients that are courier services. Yes, the health information or the script is in an envelope, but you're still carrying that script. How do you handle that?
Yep.
What's the access control?
Yep.
So,
Yep.
can you take care of patients, right? Yeah. Can you bill? Can you get paid? Can you recover? And those are kind of some of the areas that we really see. So that's kind of where you see the difference between the business associates and the actual covered entities.
And then a step further, if you were in Texas, everyone's considered a covered entity. So that's a whole nother ball of wax right there. Texas has its own BAA and its own
even the compliance steer, right?
Right.
Because you got to have a compliance steer.
Yes. There you go.
You definitely have to have that. So.
But yes, that was a big important part of HIPAA compliance is that BAA. And it's very important to have with your customers and to make sure that it is separate from the contract. Correct.
So we created everything in 2003. We got to 2005 and 13. Then we got Omnibus. We got the high tech regulations, and then all of a sudden 2025 came around. So about a year and a half ago, HHS published its proposed rewrite of the HIPAA security rule. It was supposed to be completed in June of this year. We'd heard fall of this year. Last week, I heard February of next year, and there's it's kind of a moving target. But like Dawn said, the HHS has a conference next week, 2 weeks, next month in DC, and we're going to be attending that and bring that information back to the podcast because we need to know what's going on so we can support our clients and give the information back to you. So it's going to be a lot more in depth. And what are some of the areas, Dawn, that they're looking to change?
Yep. So MFA, which
Required.
Again, that's been around for a while, but they're finally saying, nope, you need it.
Yep.
Encryption, technology asset inventories. You got to keep track of your assets. Network maps, your data flows. Very important, especially with AI coming in and integrations. Where's your data flowing? Vulnerability scanning, pen testing, huge right there.
Mm-hmm.
That is going to be a requirement. And there's going to be more specific recovery expectations and more documentation. Again, this is all very loose. Not really sure if there's going to be any specifics to dates to certain things. Is it all going to be in effect in 2027? We're going to find that out for you.
Yep. These are all proposed. Pretty much all the addressable items that are today are going to become required These are also ones that align with all the industry standards and recommendations from NIST, ISO, SOC, HITRUST, all of that. So everything I think it aligns very well. So that's what we're going to do, is keep an eye on everything between now and the first of the year to see what changes, and we'll keep everybody updated on
Yep.
the
Yep.
podcast.
Yep.
And that's long term, but the security rule is still enforceable right now. It hasn't changed. There are multiple actual, breaches on the HIPAA wall of shame, which we should bring that up, right?
Which
And
is a
talk
fun
about
thing to look at if y'all haven't looked at that.
which is not a bad thing to look at. Yeah.
Yeah.
Because there's still a lot of breaches, and it happens all the time.
Yep. Absolutely.
So,
Absolutely. So again, the plan, it was supposed to be, was proposed earlier this year. It was supposed to go into effect this year. Doesn't look like that's going to happen. We're going to go and, attend the seminar, see what they have to say in a couple weeks, and see what else is, are those just the proposals? Is there more? Is it going to be effective in January? Are they going to wait till middle of next year? What else is coming to play? That type of thing. So my guess is that because AI has been such a huge piece of everything lately, my guess is that they're probably they are going to be talking about AI and HIPAA, but my guess is they're kind of probably trying to work some other things in. But again, that's just a guess. So we'll see.
Now, I think since it'll be fun, Dawn, I'm going to share the actual HIPAA wall of shame, because if you're listening on the podcast, obviously you won't see it, but if you're on the YouTube channel, you're going to check it out. So I'm going to share it, and we're just going to take a look at this thing. This is the HIPAA wall of shame. So the easiest way to do it is just go to your Google and do HIPAA wall of shame, and it pops right up. It looks like 1993 with an old MacBook from 1993 or 2002. It has the old icons of, it's very governmental, right? Like, I think that's like Excel 2007. I don't know, PDF, CSV. But here's the deal. Look at the dates. That's less than a month ago. Was already there. And look at the amount of people's lives impacted. So part of the old HIPAA wall of shame here is you get to be publicly shamed. And this means that every SEO, every engine, every AI, every customer knows that you had a breach. Even your insurance provider knows you have a breach. And look through here of all the issues. Now, Don and I go through this. I get it kind of each week, because they update it pretty much weekly, or sometimes every look a little behind every couple of weeks. Here's a few days, right? But there's a big theme: is the hacking is the big things. Email is a big issue. Desktop servers are a big issue. Look at that. Paper films from TenCare. They're stealing films. They're probably.
And there's the Care Cloud. Look at that one.
Cloud?
Care Cloud 3. Is that 3 million? Or is that 3 million? Yep. We have clients that,
think of that,
have been part of that. That is a huge, huge one. Look at Vanderbilt University, high-end university. Doesn't matter. Doesn't matter how much money you have.
Unlimited technology systems. It's another 3.8 million.
Yep. Look at that.
And it doesn't matter if you have $1,000 budget for security or $100 million budget for security. If you don't do things properly, you will end up on this list. But the worst part is, look at all these lives. There's 7 million lives impacted right there between those two.
Hacking, network server, email. I mean, people are still getting hung up on, they're still getting email phishing is still a thing. Network servers, folks, pen testing. You have open doors on your network. Pen testing is going to find those. I mean, it's just unbelievable. Yeah, look at all these. And that's just July. This is just July.
It's just July. It goes all the way back to 2013.
So and it's all over the country. All over the country.
Look, all the different states. A lot of payer systems, because we have to reason it's so valuable. Is that I would say it's more valuable than financial data now.
Yeah, for the family dental. I mean, look at all these small clinics and stuff. Think of that, and we hear this all the time. We hear the small chiropractic. Oh, I just started. It won't happen to me. You're small. you're going to be a target. You're
Mhm.
big, you're going to be a target anyway, but just because you're small and you just started out doesn't mean you don't need to be compliant. Look at this, just, 500 people, and over 500, you have to go to the media. You have to tell everyone has to know, and every individual that's affected has to know. This isn't just one person. This is lots of people. Yeah,
But it kinda really shows you, and it's I don't know, sometimes I'll get geeky and download it and put it in a sheet and graft it all out, but
yeah,
it's unbelievable. Well,
it's
other thing
alarming.
while we're here is, well, the archive report. That takes a little bit longer, because they'll archive off last year, which is massive as well. But here's help for consumers. You can now go ahead and request a copy of your own health information and amend your health record if you had a breach and you feel that your information was compromised. And also, you can file a complaint with the FTC because now the FTC monitors HHS breaches. So now there's all of that as well. But these are just still under investigation. So we've helped clients through them. We had people come to us after breach and we navigate that. That's what it's the service that we provide. 2 months to 4 months, sometimes 6 months. And you got to deal with the government on that. But I just figured it was kind of nice to show.
Yep. And HIPAA's been around, a long time, but it's not going away. And it is required by law to be HIPAA compliant. And SOC 2 is nice to have, ISO is nice to have. Oh, my clients, their contract tells me I need it. We can help you with that, sure. But HIPAA is the only required regulation.
Yeah. That's why I call it the HIPAA.
The HIPAA.
The HIPAA.
It's going to be around
Yeah.
forever.
Laws, once laws are in, they're always there forever.
Yep.
So,
Yep.
but going on to the next section is kind of like what didn't change, right? So let's talk about what hasn't changed. A lot of stuff that hasn't changed. There's no new acronym. There's really not too much in the work except for the security rule on where health information is located. But I'm really starting to see more pressure around access controls. You talked about that earlier, Dawn, right?
Yep.
The access controls of not only where your data is and who accesses it, but your third parties.
Yeah.
And to
Third party is a huge piece of HIPAA compliance. Is you need to know what your third party partners, vendors, whatever you want to call them, are doing with your data or your client's data. It is interesting to me that everyone will go get some fancy something because it integrates or an AI or this or that.
MCP.
Just to get things done, and it's all fun and everything, but where is that data actually sitting? Is it backed up? So we have to be very careful.
Yeah.
Very careful.
And a lot of people don't know the name of their systems.
Yeah.
To protect them.
Mm-hmm.
Or maybe they had it from last year and then we come into this year's audit and go, we've added 17. Really? Oh, what are they? Don't know. You have to go through that, or the vendor names and who's looking at that. You have to vet the vendors and understand that as well. Not just HIPAA, but any compliance framework.
Yes.
Anything you're doing. I mean, even energy. You got NERC compliance. You got to do that. Shout out to the NERC folks. The nerdy NERCs. The nerdy NERCs. That's
there you go.
But every system has to be identified and documented. And there's agents and tools, yes, they can do that, but you still need the humans to take a look at that and see what's going on. And then really it kind of dives into policies, the types of policies we have and what we need. Now, you do a lot more policy writing here because you're good at grammar. So what changes have you seen in policies and what's been updated lately?
Yep. Policies, a lot of AI. Because you really need to give your employees the AI guidelines, guardrails,
guard lines. Let's call them guard lines.
to let them know how it can be used or it can't be used. And then also you need to make sure internally your systems, are they allowing it? Are they not allowing it? Does your IT, are they blocking it? How are you handling it? Because if you roll it out, you need to tell people how to utilize it or how to not utilize it. So policies and procedures are still extremely important. The AI piece of it, very important now. a lot of people are having their employees sign off on a lot of documents now, making sure they understand it. So we're streamlining our policies here at Van Ryn, making them a little bit more, kind of grouping them together, making a really robust access control policy with all these items kind of within it, just talking about all the access. We're talking passwords, multi-factor, and so really just have those policies and have your employees and your staff understand what it means and where these policies are. And you should have them sign off that they've read them.
And
So,
kind of going from policies to going to procedures, right? Is the backup and incident response plans. How, all those, everybody on the hip wall of shame, what's the response? How are we going to talk to the media? How are we going to tell our 3 million customers that we impacted them? Who's going to pay? Who's cutting the checks to deal with the credit monitoring and the financial freezes and all that? Yeah. And it's a real contingency plan with a real backup capability is really the key piece. Can we get back to where we were yesterday? You should be able to get back within the hour, would be the best, or within 10 minutes. But sometimes we've seen that fail. But can you get back to last known good and really get dialed in there? And our standard here at Van Ryn is really simple. You've got to prove it and you got to test it. Like, do you actually have that? And do you have your contingency plan? And not just upload it from last year. Have you touched it? Did you create it once from the last audit? Do you have meeting minutes that you've actually went through? Do you have just a quick note of capturing what you went through to go through and test those? Because without dates and all that, then we have nothing, right, Dawn?
Yep. And can you restore it from your backup? Can you restore your environment? That's really important. So knowing how this all works and what to do and the steps and the procedure to it, that's important. And a lot of people just say, oh, well, I just, all my stuff's in EHR and they have to deal with all that. Well, no, because the data is going from you to them and them to you. And, there's data moving back and forth on your network and within your network. And so you have to make sure that you yourself, you have disaster recovery.
Yeah.
You have all that. It's not just your vendors.
Yeah. Not just the vendors.
Yeah.
And I think really it goes from, we've talked of the history of the HIPAA regulations into the compliance landscape of policies and procedures. And now what I think is really important is culture. We talk a lot about it. Culture is very important to Don and I, but it's really about the culture in your business. Have you really gotten the folks on board with how we're handling data, the steps we're going through, how do we secure it, and who's on point? You've got to have your CISO, it's a compliance officer, a security officer, someone's got to be designated. And our clients that are very successful with their compliance and security has someone that's actively focused on it. There's some clients that are fortunate enough to have just the compliance officer and he or she manages everything. Sometimes it gets dumped in IT. And then one person's has multiple hats. But it's really about putting that the culture into the business and making sure people think about things before they sign up for the latest, bot, for the agent, the AIs, all of that. Take a look at subprocessor. Take a look at the trust centers. Take a look at the documented. Do you really know where that data is going? Because we've gone from the days of, oh, it's kind of good to, we have to start kind of prove it to, okay, now I need to see your third parties. Because that's the really key is making sure we know where we are. And it's really kind of the same story, different room though, right? So,
yep. And in the last 20, 30 years of HIPAA, the big thing has changed is we used to have big binders of paper, big binders of all the policies, procedures.
Still.
Now, everything's electronic. Everything is like, we put it in our employee, HR platform, employee center, whatever you're using, and they have to go through and sign off on it. And that type of thing. And you can do it on your phone, you can do it on your iPad, your laptop, whatever. And so that's big too, is that now it's becoming where you're not just sitting there at a cubicle and you're leafing through all these papers and this huge notebook. Is you are now online reviewing stuff online and having to actually do an e-signature that's date and time stamped. And so there's a lot more at risk now because there's more data now. But we've gone more electronic. So yes, that adds more risk, but it also is you've got to You've got to be accessing certain things. You've got to be able to read through things and sign off on it. I mean, it's a lot more in detail and in depth now. So, yeah, the old binders, oh, there's the binder and on the on the
Binder.
bookshelf. That's no longer. This is really important, and that's why it's important to have the right person that's a compliance officer or security officer, privacy officer, whatever you call them, that's in charge of compliance, and they can implement it to the team and tell everyone how they need to be compliant by taking their training, by reading certain documents and signing off on them.
Yeah. Because
Yep.
when you have an incident, and it will be a when, not a if, you have to make sure that you're ready for what to do. What to do when something happens. So as we're getting, as the last few podcast episodes, we've talked about college, we've talked about our family, opened our playbook a little bit. So now, like, we're all getting back to school. What do we do this fall? Like, what are we actually going to go through? We've done the history. We've gone through all that. I think right now it's not about waiting till 2027 for the final HIPAA rule. It's about living it every day because attackers, hackers, and your customers depend on you to protect their data. You can't just wait on it. You can't just wait and go do whatever.
Yep.
I
Yep.
would definitely say do not wait. Right, Dawn?
Right. Right. Compliance isn't just a one and done. It's a daily discipline. Ooh, daily discipline. I
Dawn's
just made that up.
daily discipline. Ooh,
Daily discipline. There
that.
you go. And because something will come up. Something will come up, something will happen. It may just be just an innocent incident by someone, in your staff, but something will come up, but you always have to be diligent and know what to do. And it's a different landscape now
It is.
because there's
Yeah.
so much more risk, and you just have to just pay attention. Things are moving quickly. So, and we even noticed that with signing our son up to college. There's a lot you have to sign off on. There's a lot of disclaimers now. There's a lot of I mean, it's like scroll, yes, yes. Okay, scroll. Oh yeah, and I owe you this. Okay, yeah, scroll. I mean, it doesn't matter how much you pay. That you got there's a lot to read, a lot of disclaimers now. So that's the world we live in.
It is. And the first thing to you set up your team is name the owner, right? It's the kiddo to take care of himself, or it's a compliance officer in your organization. And then he or she creates that rhythm,
Yep.
right? Our compliance mindset. We know what's red, yellow, green, what's blocked. What we'll do here at Van Ryn is every Monday, the bot goes out. Yes, the Slack bot goes out and ask the team, what'd you do last week? What's your wins? Where's your blockers? And what are you working on? And the team has clear visibility for everybody, the entire team. Now we're a small team. Yes, I know you've had, hundreds of employees. That could get noisy, but you can break those down into separate departments and then roll those up as needed. And then from that, you just make sure you're dialed in on the solutions, the policies, the procedures, and don't wait for it to happen because it will happen. You may not see the breach or the incident or have a lapse in your compliance, but your third parties and their downstream parties, fourth, fifth, sixth, seventh party down the road, maybe there was a small hook, small MCP that had an issue or an API that had an issue and it impacted you. You didn't even know it for weeks. Those are the key things. So
Yep.
Yeah. So I think we did good this week, Dawn, kind of walking people through, getting things dialed in, kind of where the history of compliance is, kind of where we're going, and those call to actions for our listeners. Any parting words of wisdom?
Yeah, just it's important that your organization has someone that can wrap their arms around it, has one person or a team that can handle the compliance, make sure everyone's on the same page, make sure there's things implemented because there needs to be documentation. There needs to be, how do we do this? How do we do that? So just make sure that, you're just keeping up with everything. Annual audit, policies, procedures, annual training. Good news is we launched a couple weeks ago certification. So if you want to be an actual certified compliance officer, go to our website, and for $99, you can become a certified compliance officer. And that will give you all the tools. If you're just coming from, hey, I was in HR and now I have this job I have to do now, or I'm coming from being a manager, it's a great, robust training that you can take, get a certification. You can share it out to the world. You'll have an actual certification number. And we did that because there is people that say, I do not know how to do this job. Help me with that. And it's great. So yeah, please visit our website if you want to sign up for it. You won't be sad about it. It'll be really good information, and you'll feel confident that then you can be able to handle the compliance at your company.
You know exactly what to do.
Yep.
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 I think that's good, Dawn.
Yep.
So thank you everybody for joining. I'm Rob,
I'm Dawn.
and have a great week. Talk to you next week.
Bye-bye.
Bye-bye.